Last time on this show, I told you that July 28th was going to be the World Hepatitis Day. It was a day marked globally to raise awareness about a disease that is as deadly as AIDS and ranks the same as the world's deadliest disease, which is tuberculosis. While then, I couldn't bring you a medical doctor to shed light on the subject matter, today I do. On that note, I say welcome to Talking Health, your authoritative health program on air. To do justice to today's topic, which is hepatitis, is Dr. Rufina Igete. Dr. Igete is a gastroenterologist with the Lagos State University College of Medicine. She is an author and has contributed to research topics on hepatitis B and C. She has also contributed to research on hepatocellular carcinoma occurring at an earlier age in Africans, particularly in association with chronic hepatitis B. Thanks for joining me, Dr. Rufina.
Thank you very much. It's my pleasure to be with you.
Thank you. Now, let's go right into the purpose we're here today. We've been hearing about the case hepatitis. As a medical practitioner who is also a teacher, can you please educate us what actually is hepatitis?
Okay. Hepatitis simply means the inflammation of the liver. Now, inflammation is the initial response to injury to the liver cells. Now, injury starts as an acute condition, and if the injury continues, it can become chronic and can eventually lead to irreparable damage to the liver cells. At which stage we begin to talk about liver cirrhosis. And once you have severe damage to liver cells, there are always severe consequences. Eventually, if that injurious agent is not taken care of, it can eventually progress to liver cancer. And that is the terminal stage of the spectrum we have for response of the liver to any form of injury. Hepatitis is simply inflammation of the liver.
Doctor, when I hear hepatitis A, B, C, D, and E, to me it sounds like we're talking about vitamins. Okay. What can you explain to us which one is hepatitis A, which is hepatitis B, C, D, and E, so that we can be properly grounded?
In my definition of hepatitis, I mentioned injury to the liver. Now, injury to the liver can be caused by many agents. Some of them are living organisms like viruses, bacteria, even parasites. And some others are actually chemicals. Perhaps we may get to talk about all of those things. But going back to your question, referring to hepatitis A, B, C, D, and E, those refer to specific type of viruses which have a preference for affecting the liver. They could cause some minor diseases elsewhere, but their main target, their main preference are actually the liver. So there are 5 types of them. So you have hepatitis A, virus, hepatitis B, virus, hepatitis C, virus, hepatitis D, virus, and hepatitis E, virus. Now, some of them have subtypes. We are not going to go into all of those details, but at least those broad classification of the hepatitis viruses, which have a preference for affecting the liver rather than other body cells. Those are specific group of viruses we usually refer to as hepatitis viruses. But there are, however, other viruses that can also affect the liver, even though they have preference or they could equally affect other sites in the body. But these ones specifically go for the liver and have little or no effect on any other tissue in the body.
Okay, so because I'm very concerned. So which of these, there are 5 variants now, which of these is the most dangerous and why?
Now, all of them are dangerous because now we refer to the degree of damage they can cause to define how dangerous or severe they are. So each one of them actually is dangerous. Each of them is capable of causing acute liver failure.
Oh, really?
In itself is a very dangerous condition.
Wow.
However, there are some of them that may not present acutely and as dramatic as others. And they can run a very silent course without affected persons being aware of the presence, and over time slowly cause damage. So you have those that can cause predominantly acute infection that could be devastating. So viruses, hepatitis A, hepatitis E virus, both of them usually run acute course, and those ones can easily be curable.
Okay.
But for viruses like B and C and D, those ones tend to run a more chronic course and can go on to cause long-term liver damage. And these are the ones that are actually more associated with causing liver cancer, which is the most severe form of chronic complication of the infection.
Wow.
So all of them are dangerous.
Oh, so what are the symptoms, so that before it gets to that critical stage, what are the symptoms that somebody should watch out for?
At the initial stage, the symptoms may not be different from any common or usual febrile illness that we are used to. And the typical diagnosis that most people come down with is typhoid and malaria, because they have a febrile illness. They may have joint ache or muscle ache or headache. They may feel unwell. They may even have some abdominal symptoms like nausea or vomiting. They may lose appetite. Some may come down with diarrhea during the process. And if it gets really complicated and very bad, with time, they will develop some pain and maybe some swelling on the right side of the upper abdomen, and eventually yellowness of the eyes. And if that progresses and the damage continues, some of them may even begin to lose consciousness gradually until they go into coma. At that stage, we have what we call fulminant hepatic failure. Okay, and we say such person has hepatic encephalopathy, meaning damage to the brain due to abnormal liver function.
Wow.
And some of them may even have abnormal bleeding during the process. So it starts usually like the usual febrile illness that we are used to, symptoms similar to those of malaria. And then eventually it is settled down to the liver with yellow eyes, and then pain in the right upper quadrant of the abdomen. And then if it progresses, some bleeding abnormality, probably bleeding under the skin, passing blood in the stool, and then eventually they may begin to lose consciousness. That's for the acute form. Now, for the chronic form, they may just have repeated, febrile illness and some weakness, feeling unwell. And they may not be able to differentiate those symptoms from the usual malaria symptoms, like I said earlier. It is only when the damage to the liver is so bad and severe enough that they begin to manifest specific symptoms of liver disease. And those specific symptoms could be generalized swelling of the abdomen. Then they will notice yellow eyes, what some people call yellow fever. They begin to notice swelling on the right upper side of the abdomen. And then when cancer develops, they may notice weight loss as well. And some people may actually vomit blood. It could be frank blood or altered blood. Some could pass blood in the stool or pass black stool. And until it progresses onto. Some people may even come for the first time with altered level of consciousness. So the presentation when it is chronic varies, but the commonest presentation we see is that the people will come in with generalized swelling of the abdomen, and then they may probably have yellow eyes, which is commonly called, some people will refer to as yellow fever.
Okay, doctor, thank you so much. Let's quickly take a short break. We'll be right back.
I am the life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only, I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party.
Welcome back. Now, Dr. Rufina, let's start from this. Before I go to the next questions that I actually wanted to ask, I want to find out, okay, how long does it take? What is the duration of this progression? When I say the progression, I mean the progression to break down. What's the duration of that progression?
For the common ones, most of the symptoms may end within 8 weeks. But in some cases, it could continue for up to 6 months. Now, once the symptoms go beyond 6 months, it becomes chronic. So anything that goes beyond 6 months is now chronic. That's first stage of being an acute infection or acute hepatitis to being chronic hepatitis.
So how is it diagnosed, really?
So from the complaints the patient may have, the symptoms they may have, I just mentioned some of them: feeling unwell, fever, headache, joint ache, and then they will notice yellow eyes, and some may have some pain and swelling on the right upper side of the abdomen. And in some people, they may actually tell you that they have been in close contact, or there have been some similar symptoms in persons around them of late. In some persons, perhaps maybe a family member, a relative who had passed on from symptoms of hepatitis. Okay, those are clues. Now, laboratory-wise, there are specific tests we can do to actually confirm whether there is hepatitis and the real cause of the hepatitis, and even to stage and categorize the disease properly. So laboratory tests will help to categorize the situation.
Okay, so what are the main causes, so that at least people can deviate from the causes? What are the main causes of hepatitis? Initially,
in the introduction, I had mentioned all kinds of viruses. Any virus is capable of causing hepatitis. Even HIV virus can cause hepatitis. Okay, so all kinds of viruses. But specifically, hepatitis viruses, like I said earlier, hepatitis A, B, C, D, and E. Then bacteria, because the same way bacteria can affect other organs and cause infection, it can also cause infection within the liver. And then even some fungi, some parasites can also go on to affect the liver. They can cause surrounding hepatitis while they're still causing other form of damage or specific damage to the liver. Now, I will go on to other things that people take, because the liver is like a laboratory for many things. Most of the things we eat, we consume, eventually pass through the liver and get purified in the liver. So people who drink a lot of alcohol, for example, it can also cause hepatitis. There's something called alcoholic hepatitis. And currently, the same way in people who are obese, you have distribution of fat cells into the skin and other tissues. It can also have fat cells being laid down in the liver. Okay, so we can talk about steatotic hepatitis, and it's commoner among people who are overweight or obese, or people who have diabetes mellitus. Okay, so that's a newer form now we are seeing worldwide. And also in this environment, we shouldn't forget abuse of certain medications, because all the medications we take get metabolized in the liver. They're either activated or destroyed or deactivated in the liver, and they also have their own effects on the liver. So some of over-the-counter drugs, some of the antibiotics that we take for granted can damage the liver in some persons and can do severe damage. Okay, so we're not going to even talk about other medications which we use to treat other things. But also we should not shy away from all kinds of herbal remedies that people are having resort to now to take care of certain conditions. Some of these things have not been well studied, but we have actually seen people who have come down with liver damage, either from overuse or abuse of some of these herbal substances.
Okay, doctor, let's break it down a bit, okay? I have a couple of friends in the past. Before a house help enters into their houses, they must do a hepatitis test. They say it can be transmitted. So can you, take us through how can hepatitis be, transmitted so that people can be more aware of bringing in strangers into their own homes?
For now, I'm referring strictly to the hepatitis viruses, A,
Yes.
B, C, E. Now, hepatitis A and E are transmitted through eating or drinking contaminated food or drink.
Okay.
So that will come through poor environmental hygiene or food hygiene or personal hygiene. Because somebody who is infected passes it out through the stool, and if that contaminates the environment or anything edible, and then that particular food is not well processed before consumption, one can get hepatitis A or E through that route.
Okay.
Now, for hepatitis B, C, and D, they share the same root or common roots as HIV/AIDS. Now, having said that, it is not only those who are promiscuous who get hepatitis B, C, or E. Those who abuse injectable drugs are at risk. Now, in our environment, hepatitis B is of more significance because the prevalence of hepatitis B, and incidentally, we fall under what we call the hyperendemic zone of hepatitis B virus infection, where you have a population infection rate of greater than 8%.
Why is that?
Yes, so we fall under this zone, and unfortunately, the hepatitis B in this environment is acquired during childhood, either during birth or childhood period when children play and mingle together. Around that age, the immune system of such persons is not so well developed. Now, hepatitis B comes into the bloodstream. All it wants is a conducive place to go on to start propagating itself. And the liver is the most suitable place for that to happen. So it goes to the liver, the immune system is silent, it's so weak, unable to do anything about it. So the virus takes over, embeds itself into
No, doctor, just a minute, because I got the aspect when you said, when children mingle together, particularly. So when they mingle together, how does it get into the liver? They're just playing. I need explanation.
Children have wounds that are discharging blood or body fluids.
Okay.
And when they play together, they can get bruises. So what you need for transmission of hepatitis B is actually any part of the blood, any fluids or secretion from the body. So it could be blood or blood components. It could be from the semen.
Okay.
And it could be from tissue transplant from an infected person.
Okay, no, but what about sweat?
No, sweat is very minimal. It's very minimal. The rate of transmission to the sweat is very minimal.
Okay.
Yeah. What is hepatitis B is that it is highly infectious. It is about 100 times as infectious as HIV. People don't know about it. People say very little about it, but it is highly infectious. And what do I mean by that? If a drop of blood or body fluids or serum from an hepatitis B infected person drops on any surface, and that surface is not well sterilized, the virus can remain there viable for over 100 years.
What? Did you say 100 years?
Anybody who has an open wound and exposes that open wound to that surface can easily get hepatitis B infection. That is how infectious it is. So even from a dried blood secretion you are seeing, or dried blood spot you are seeing on the floor from an infected person, it is capable of infecting somebody else who has an open wound, and that open wound has come in contact with that blood component. That is how infectious it is. Now let me go back to your question.
Yes.
You know, as they play and mingle together. Okay, so I explained that scenario. And children that are usually very innocent, while playing, they can share toothbrush in the process. So if one child has hepatitis B and has just used the toothbrush, brush it, you can bruise the gum.
That's right.
Unless if that toothbrush, the another child goes to pick it up. These days, we talk about various ways. Talk about people who go around sharing manicure, pedicure sets, you know, amongst clients. And we know people are likely to do that. All these roadside pedicures and all that. Those ones are not likely to sterilize their equipment, and they're likely to share the equipment among many people. People who visit quacks for surgery. And at the time we looked at the risk factors for hepatitis B, we found there are many people who have done scarification in the past. And we know those days, scarification was a means of treatment, not just a thing of beauty. Many people had some form of herbal medicine administered through those cuts that were instituted as scarifications those days. So that was one thing, because the traditional medicine, we use the same blade for everybody. We not sterilize it, we not use it. And then you still have people living up to present days, when they are sick, they still go to chemists. Who are you patronizing at the chemist? Some of those people are not trained medical personnel. They are just shop attendants who are trained probably to sell medications. They are not pharmacists. And yet some of them somehow have managed to be able to administer injections to people. And people patronize them. They are comfortable doing so. So how do you think they'll be able to protect if they're not even educated as to the presence of hepatitis and how it is spread? So those are some of the problems that at the roots we still have. I know that these days we talk about drug abuse, and it's getting rampant in our society. But I'm not sure people still do so much of the injectables. There are other means of administering it now, but thank God that is it. Otherwise, that would have been another means of spreading hepatitis in our environment.
Wow.
So those are some of the yes. And then also you look at us vertical transmission during pregnancy, when the child is getting born, being delivered, during delivery. It's true that these days in the antenatal clinic, every mother gets screened for hepatitis virus. And those who are positive are supposed to undergo some form of monitoring and treatment, and to ensure that those children get immunized as soon as they are born, to prevent mother-to-child transmission, which is a great risk for developing chronic hepatitis B. But you find out that some people are not even educated enough. Some mothers, about half of the mothers don't know their status, and yet they have put to bed 2-3 times, and they have done that test. So they have not been curious enough. And what you don't know about, you're not curious about it. If you're not curious to find out my status, even if I was positive during the last pregnancy, am I positive now? So they don't even know. Let's talk of now doing the necessary follow-up to ensure that the virus is not transmitted to the newborn. So those are some of the issues we have. I think the major issue we have regarding hepatitis and hepatitis B virus infection in our environment is actually ignorance. Many people are ignorant of the situation, and they're also ignorant of the severe complications that can follow hepatitis B virus.
There's no gainsaying it. Intense grassroots education and enlightenment about this deadly disease is essential. Our government needs to do more. But every individual also has a role to play, particularly knowing that an infected blood needs not be fresh to infect others. So take precaution and take charge of your environment. And that's how I wrap up today's edition of Talking Health with Bumi. For comments, questions, and inquiries, please call the numbers scrolling. You can also view all our past editions on Conga TV on YouTube. Remember to subscribe, like, and share. Until next time, think health matters. Think Talking Health with Bumi. Bye.